as most of you probably know, my name is Dr. Jessica Zucker. I am a Los Angeles-based psychologist, and I specialize in women's reproductive and maternal mental health, and I've done so for over a decade at this point, long before undergoing a second trimester loss firsthand. I'm also the creator of the I Had a Miscarriage campaign and the author of the book, I Had a Miscarriage. Today, I am so honored to be speaking with Sheetal Parmar, who is a board-certified genetic counselor and the head of clinical services at Untitled, a genetic testing company. This morning, we will be talking about miscarriages, why they happen, and ways to find support from a genetic perspective after experiencing one. As many of you have probably seen in my Instagram stories over the course of October during Pregnancy and Infant Loss Awareness Month, I've had the privilege of partnering with Natera to raise awareness about miscarriage and why it occurs. And as you probably heard me discuss in my book or in previous posts on Instagram and elsewhere, I had a 16-week loss, and within a couple of weeks after the loss, I learned that there was a chromosomal abnormality. And this information really helped me and helped my husband because, it sort of grounded us in the reasons why. And so taking out that medical mystery allowed us to process our loss in a very different way. I think it's so important for women and families to know that something like this exists, a test to determine if genetics played a role in this unfortunate outcome of pregnancy. And that's why I've invited Sheetal to talk with us today about miscarriage and how genetic testing can help us better understand pregnancy loss. So from here, I'm going to open it up to Sheetal. We have tons of stuff to cover and very important questions for you all to learn about genetic testing and how it can help you moving forward. Okay, so can you tell us a bit about your work and give the listeners a sense of what a genetic counselor is?
Yeah, thank you so much for inviting me and partnering with us, Jessica. It's really a privilege to be here today. I'm a genetic counselor by training. I'm currently the Vice President of Medical Affairs at Natera, which is a biotechnology and genetic testing company with a mission to change the management of disease, including genetic disease. And I'm also a board certified genetic counselor, as you mentioned. Before I joined Natera in 2013, I was a prenatal genetic counselor for 11 years at a prenatal diagnosis clinic. A lot of my experience comes from meeting with couples and individuals who are pregnant or thinking about becoming pregnant to talk about genetic testing and what options there are to review genetic testing results and what they mean for families. So that's a lot of my experience working with people who are pregnant, who may have experienced pregnancy loss or considering pregnancy in the future. In general, I would say genetic counseling is really the process of helping people understand the medical, psychological, and family implications of the genetic contributions to disease. And that can include, as I mentioned, talking about different testing options like we're doing today, different procedures and results, educating, patients, educating healthcare providers regarding how genetic disease is inherited or how you might manage it based on information in your family, taking family histories and understanding what that means for a genetic disease in the context of somebody's family. And then, of course, very importantly, providing emotional support and resources.
Yes. Okay. Well, so that's a lot, right? So,
yeah.
So, after somebody has a miscarriage and they're so overwhelmed, they're so disappointed, there's such a mix of feelings that probably occur in the aftermath of loss. So what happens after somebody has a miscarriage in terms of genetics? So how do they can actually connect with a genetic counselor, and how do they access testing if they want it?
Yeah, that's a very good question, and not a lot of people know where to go. So genetic testing is available that can be done, can be ordered by your OBGYN or your midwife or whoever you're seeing. It can be ordered through them on the tissue from a miscarriage. We call it products of conception. So that type of referral, once you've had genetic testing or you're considering it, your healthcare provider can refer you to a genetic counselor. There are usually many genetic counselors that OBs know about that they refer to in the area. If you're having genetic testing through a laboratory like Natera, you can also contact the laboratory and speak to a genetic counselor in the lab before or after you have testing to get some information about that. So those are different ways that you could end up speaking with a genetic counselor. Oh, no, I do not hear you. Oh, no, I
That was
think there
strange.
you are.
Okay.
Yeah.
I put the do not disturb, but a call came through anyway. Okay. And so, as you know, from a psychological perspective, the research shows that a majority of women are blaming themselves in the aftermath of loss and are looking for answers to try to understand what happened. Oftentimes they go to this sense of like, what did I do wrong? What could I have done differently? Is my body failing me? But what can the role of genetic testing play in this so that people can actually hopefully quiet their minds around this self-blame that so often is misguided?
Yeah. The process of going through a miscarriage is so difficult, and, people often don't know where to turn or do feel a sense of blame or shame. And they shouldn't, because miscarriage isn't caused by anything someone does or doesn't do usually during a pregnancy, right? And we know that over 50% of miscarriages are due to what we call chromosome abnormalities. Chromosome abnormalities are genetic conditions that can occur. They're not caused by something you do or don't do during the pregnancy. They're spontaneous. For those of you in the audience who aren't familiar with chromosome abnormalities, basically all of our DNA is packaged into chromosomes. So most of us have 46 chromosomes. We number them from 1 to 23, and then the last two tell us if someone's biologically male or female, so how many X's and Y's you have. And they come in pairs, so you get 23 from each parent. So I have 23 chromosomes from my mom and 23 chromosomes from my dad. And in over 50% of pregnancies, there can be something extra or missing that occurs in the chromosome. So a whole extra chromosome or missing chromosome, or even small pieces that can be extra or missing. And that's what the genetic testing that we're talking about today looks for. That's what our NORA test is looking for.
So, and how does that work in terms of, okay, so somebody goes to their OBGYN, their doctor tells them about the possibility of testing. How long do they have to wait to find out these results typically? And can they actually access the test, I don't know, a week, a month, a year even after a miscarriage, or does it have to happen immediately?
Testing can be done so at the time the miscarriage occurs. So for example, if an individual like a patient can request a kit from our website, for example, or from their OBGYN, if their OBGYN has kits, and you can take one home and their instructions. You can also do testing on the tissue if a patient's having a DNC or DNA procedure, post miscarriage or post demise. So, and results typically will take about a week to get back. So it only takes about a week once the laboratories receive the sample. But it's a really great question you're asking about a prior miscarriage, one that happened maybe multiple years ago. And yes, we can test for those. So if there is tissue available, for example, when sometimes tissue is sent by your doctor to pathology, we can do what we call a paraffin NORA. So instead of using fresh tissue, which is what is typically done at the time a miscarriage happens, we would get the tissue immediately. We can do it on older tissue as well and still get results.
Oh, that's incredible.
Yes.
So why do you think that so under talked about, right? So it's like, if these options exist, but so many people don't seem to know about them, why are we not talking more about the option of genetic testing, especially if it can be done, years later?
I think a lot of us just don't even think to ask our healthcare providers, is there something that I can learn from this testing? There are some professional guidelines out there for healthcare for genetic counselors and for other healthcare providers or physicians about what types of testing can be done after. Usually it's multiple miscarriages. I think a lot of the talk that happens is you've had 2 or more miscarriages. That's when they start going down maybe a path of testing. But certainly, this information can really help people understand what their risks are and heal. So having this information after any miscarriage could be very useful.
Right. And so is this something that most people can afford? I mean, so, what does the cost look like? And what if it's not offered by their OBGYN? They can order it from your website directly, correct?
Yes. So we always encourage patients to talk to their OBGYN about testing. And as I mentioned, this is called products of conception testing, or ANORA. But yes, a patient can, and any individual can go onto our website. I'm going to look down here my notes to make sure I'm giving you the right website. So we're going to you'd go to natera.com/ANORA, ANORA-kit. And there's tons of information on the website. I'll say that again. It's natera.com/ANORA-kit. And there's contact form information. So we'll make sure to connect you with a kit that you can take to your doctor's office, or if you need to collect at home. And then the doctor does need to order the testing, but you can get a kit that way from us if your physician doesn't have one.
Okay. Okay. Well, and so you have a team of genetic counselors, Sarah, right, that you were talking about before. Can you tell us briefly about their function and how women and families can access them?
Yeah, so we have a number of different genetic counseling teams at Natera, but we do have a very large laboratory genetic counseling team. And what the laboratory genetic counseling team does is they're available to speak to healthcare providers and to speak with patients. So a patient can go online onto the Natera website and schedule a 15-minute consultation pre or post test for any of our genetic tests, including ANORA. So you have the opportunity to speak to somebody who's board certified to get information about the test or information about your results once the results are ready. So that's the kind of service that we can provide here. Certainly, sometimes some individuals will need a more expansive counseling service beyond that 15-minute appointment with a Natera counselor. And certainly, we can help find you a genetic counselor in your community if you need a longer appointment or you have some other follow-up that needs to happen.
Amazing. That's so very important. And so what were some other things that you wanted to be sure to tell the listeners sort of about the role of genetic testing and, how this can help them both psychologically and moving forward in terms of trying to conceive again, if that's what people are hoping to do?
Yes, absolutely. So, my experience as a genetic counselor who saw patients for many years is that very many patients regret not having done some type of testing, but almost nobody regrets actually doing it because it can give you information. If the results of the test are normal, there may be other testing that can be done outside of that. But if there is something that's identified, it may give you some information so that you know if there's risks for future. In most cases, there isn't an increased risk for the future. And I'm thinking of one study demonstrated that about 78% of people wanted to know the cause of miscarriage, even if it could not have been prevented. Just having that information for closure, for understanding, just information was important to them. So I don't think there's not typically harm that comes from doing this.
Right. Yeah. Right. Can you elaborate on that a little bit in terms of because you said that oftentimes, that it doesn't mean it'll happen again. And I think that, a lot of my patients in my practice, as well as Instagram followers, assume and presume that this is going to be this long and arduous road. If they do have one miscarriage, they kind of, understandably get in this mindset of oh my goodness, is this going to be forever now? Mm-hmm. Can you talk a little bit about how chromosomes, one pregnancy doesn't necessarily inform another and the chromosomes of each pregnancy are different?
Yeah, I can give you kind of two case examples of how the information from an Anora test might inform in the future. So most chromosome abnormalities, for example, having a whole extra chromosome, an example might be trisomy 13 or Down syndrome is a chromosome condition, right? Those are conditions that happen by chance, that just there's a random mistake in the egg or the sperm. We know that that random chromosome mistake can happen a little bit more in the egg, and it happens a little bit more as we age, but it can happen in either the egg or the sperm. But when that occurs, the vast majority of time, the risk for another pregnancy with a similar condition or any other chromosome condition is not significantly increased. So most people can go on then to have a healthy pregnancy and not have an increased risk for miscarriage. So it's usually very reassuring, even if something is found, because it says, okay, this was the cause here, but that doesn't mean it's going to happen again because it's random, if that makes sense.
Yes, it makes a lot of sense.
But interestingly, so I'm traveling for work. So I'm in Florida today. And I met with a colleague last night over dinner, and she was talking about somebody who she knew who had testing, who was young. It was a young couple in their 20s, had 2 miscarriages, and on the second one, and so they were like really struggling. They were wondering what was happening because 2 miscarriages not too far from each other, had the Anora test and found out that there was a chromosome condition. And the Anora test can tell you the parent of origin if the mistake happened in the egg or the sperm. And in this case, it looked like it was paternal in origin. It was from the male, the sperm. So her husband ended up having some additional testing and found out that he has just this really random chromosome issue that doesn't affect his health in any way, but may increase the risk for miscarriage in the future. So since they knew this was this condition, it's on chromosome 13, we need to test dad. Dad got tested. And then now they know so that they can prepare by either they could use a sperm donor, they could do IVF and do pre-implantation testing, so they can do something proactive to reduce the chance of a miscarriage in the future.
Amazing.
Yeah.
Right. So basically, testing only can provide additional information and can actually sort of help not mend a broken heart, but can allow you to kind of at least understand and move forward, think about moving forward in terms of trying to conceive, knowing why something happened or knowing that it doesn't mean that it will necessarily happen again.
Exactly. It's really powerful information to be able to give somebody closure or be proactive about your future health.
Well, this has been so helpful and so enlightening. And is there anything else you want to know about before we sign off here? Because I know you have another meeting coming up. But is there anything you want people to know? Courses on your website, the company provides testing wise?
Yeah. I do want to make sure that, folks know that, Natera wants all families to be able to have access to tests, all our genetic tests, including Anora. So we're committed to increasing access, and we have price transparency. We don't want costs to be a barrier to having important genetic testing. So, if there are specific questions people have about costs or billing, certainly I would refer them to our website, of course. And then we also have a phone number that I'm just going to, say for our billing department of 877-869-3052. But certainly, again, natera.com/Anora. Anora-kit is where you can get more information. And there's a lot of information on there. There are blog posts. There's information like about miscarriage. I know we partnered with you, and your blog post about 5 questions to ask your provider is on there as well. So I encourage people to go to our website and get more information.
Incredible. And I've been thinking in my Instagram story to a lot of things, including requesting it and the shared decision-making guide that you just mentioned, which I'll do for the remainder of the month. So if anybody's interested and didn't get that information, I'll have the links available as well.
Absolutely. Yeah. And if somebody does want to speak to a genetic counselor at Natera about Anora, then you can go to my.natera.com and you can schedule, like you just go online and you can click an appointment time that works for you, or if you've received results and you have questions about it.
Excellent.
Yeah.
Thank you so much. This has been very important and illuminating. And I hope it's very helpful for the people who are here listening.
I hope so too. Thank you so much for having me. And I really appreciate you partnering with Natera on this.
It's been an honor. Thank you.